Picture this in your mind for just a moment. You are 74 years young, and honestly, you feel absolutely incredible. You are sleeping like a baby through the night. Your energy levels throughout the day are surprisingly solid, and you are actively spending your time doing the exact things that bring genuine joy to your life. There is no pain, no looming worry, just a quiet, beautiful rhythm to your days. Then the calendar turns, and it is time for your annual physical. It is completely routine, nothing special whatsoever, just a quick box to check. You sit on the paper-covered exam table and your doctor glances down at your medical chart, flips a page and says, "You know what? Let us just run a few extra tests today just to be safe." It sounds totally innocent, right? It sounds like excellent proactive medicine. But let us fast forward exactly 6 weeks. Now you are no longer in that cozy primary care office. Instead, you are sitting in a sterile, brightly lit surgeon's office, staring at anatomical models on the desk, feeling your heart pound against your ribs. You did not end up here because anything was actually wrong with how your body felt. You ended up here because those just-to-be-safe screening tests found a tiny, silent abnormality. And that tiny finding set off a massive, unstoppable chain of medical events that your 74-year-old body was simply not equipped to handle. Suddenly, the peaceful, independent life you were so quietly enjoying just a month and a half ago is completely gone, replaced by a grueling calendar of specialist appointments, scary procedures, and physical setbacks. That exact heartbreaking story plays out across American hospitals and clinics far more often than the medical establishment ever likes to admit, and the hard data behind this hidden crisis deserves a serious, completely unfiltered conversation. My name is Dr. Franklin, and this channel is dedicated entirely to one single mission: helping adults over the age of 60 understand what the scientific research actually says about their health in plain, honest language. What I am about to share with you today does not come from a single generic medical textbook. It comes from my own years of deeply studying the medical literature, analyzing clinical trials, and paying incredibly close attention to what happens to real human beings when the modern healthcare system runs on total autopilot. Here is the blunt truth that most doctors will simply never say out loud during a rushed, 15-minute insurance-driven appointment. After you cross the age of 70, some of the most common routine medical checkups can actually cause significantly more harm than good. This is not because modern medicine is fundamentally broken or because doctors do not care, but because the foundational risk-to-benefit math changes completely and dramatically as our bodies age. The problem is that almost nobody is sitting down in the room to do that complex math with you before they click the button to order the test. Today I am walking you through 5 specific medical checkups that I would personally reconsider or think twice about after reaching the age of 70. I am going to tell you exactly why the underlying math changes so drastically. I will share the devastating stories of what I have seen happen to real patients in the real world. And at the very end of our time together, I am going to arm you with a specific set of questions that will completely flip the script and change the dynamic during your very next doctor's appointment. I urge you to stay with me through all 5 of these checkups because number 3 has completely stopped many people in their tracks when they first hear the data, and number 5 is the one that most people have never even heard of until it is tragically too late. Before we dive into the deep end of this medical data, I would genuinely love to hear from you directly. Where are you tuning in from today? Please drop your city, state, or country right down in the comments below. I personally read through every single one of them, and it truly helps me see exactly who is part of this growing health-conscious community. All right, let us get started. Before we break down these 5 specific checkups, I absolutely need to ground you in one single overarching concept, because without fully grasping this, nothing else I am about to say will make complete sense. I call this concept the longevity lens. When you are 50 years old, preventive screening medicine works beautifully. You find a microscopic problem early, you treat it aggressively, and you potentially buy yourself 30 or 40 more years of active, healthy life. In that scenario, the physical and emotional investment of treatment is completely worth it, and the math is incredibly clean. But here is the massive shift that happens after you cross 70, and it boils down to 3 specific realities. First, many of the conditions detected by routine screening in older adults will never actually progress or harm you in your lifetime. They grow at a snail's pace, they cause absolutely 0 symptoms, and you will very likely outlive them entirely. But once those words show up on a black and white radiology report, the modern medical machine does not have a leave it alone and ignore it button. It has a treatment button, and it almost always gets pushed. Second, your physical body's tolerance for aggressive medical intervention drops as you age. The major surgery that a 55-year-old can bounce back from in 2 weeks can mean months of painful recovery, severe complications, a permanent loss of independence, or even worse for a 78-year-old. Third, there is a dangerous clinical phenomenon known as the cascade effect. It starts when one routine test finds a minor, meaningless abnormality. That single finding triggers a follow-up scan to get a closer look. That scan shows a shadow, leading a doctor to recommend a biopsy. The biopsy then leads to an invasive procedure. The procedure causes an unexpected complication, and suddenly a person who walked into the clinic feeling 100% healthy is desperately navigating a medical nightmare. And every bit of it started with a test they never even needed in the first place. That is the longevity lens, and I want you to keep it firmly in your mind as we unpack each of these points. Before we begin the list, take a quick second right now and tell me your name and where you are watching from in the comments, because I genuinely want to know who I am supporting and speaking to here today. Let us look at checkup number 1, which is the routine colonoscopy after the age of 75. Let me tell you a story about a wonderful woman named Dorothy. Dorothy was 77 years old, a fiercely independent retired librarian living in rural Tennessee. She had already undergone 2 routine colonoscopies earlier in her life, specifically in her 50s and 60s, and both of them had come back completely clean. No polyps, no family history of colon cancer whatsoever, and she had absolutely 0 gastrointestinal symptoms. But she went to see a brand new primary care doctor who glanced at her chart, saw her age, and told her she was technically due for another scope. Dorothy was a smart woman and did her own research, and she actually had some gut concerns about doing it. But she ultimately did not want to seem difficult or combative with her new doctor, so she scheduled the appointment. The night before the procedure, she had to take the PrEP, that aggressive liquid solution you have to drink to completely clear out your bowels. That intense fluid shift hit her older kidneys incredibly hard. By the next morning, Dorothy was severely confused, wildly dizzy, and completely unable to stand up on her own 2 feet. Instead of driving to the outpatient surgical center for her procedure, her terrified daughter had to rush her straight to the local emergency room. Dorothy was severely dehydrated, and her critical electrolytes had dropped so dangerously low that her heart rhythm was actively at serious risk. She ended up spending 4 agonizing days admitted to the hospital just trying to stabilize her body. She never even had the colonoscopy. And the deep irony of the entire situation is that she never needed it in the first place. The United States Preventive Services Task Force, which is the absolute gold standard independent body that sets the official medical screening guidelines in America, explicitly recommends against routine colonoscopy screening for average-risk adults over the age of 75. The clinical evidence is overwhelmingly clear. After 75, if you have no active symptoms, no family history, and a track record of clean previous scopes,
the immediate procedural risks start to heavily outweigh any future rewards. And those risks are not just minor inconveniences, they are incredibly real. For instance, bowel perforation, which means a literal tear in the wall of your colon from the camera scope, occurs in approximately 1 out of every 500 colonoscopies.
If you are a young, resilient adult, a bowel perforation is a manageable, albeit serious, surgical complication. But if you are a 77-year-old, a torn colon can easily translate into emergency open surgery, waking up with a colostomy bag, an extended stay in an intensive care unit, and a physical recovery process that can fundamentally and permanently steal your quality of life. Meanwhile, the actual colon cancers that are most likely to be uncovered in asymptomatic older adults tend to be incredibly slow-growing. They move so slowly that, in the vast majority of cases, they would never cause a single health issue in that person's remaining natural lifetime. So what should you do instead? If you fall into this age bracket, ask your doctor about utilizing a non-invasive stool-based test like Cologuard or an annual FIT test. These modern tools can successfully flag genuine molecular warning signs without subjecting your body to any of the harsh prep or procedural risks of a traditional scope. Now, let me be clear. If you are experiencing active symptoms, like noticeable blood in your stool or unexplained drastic changes in your bowel habits, that changes the clinical equation entirely, and you should absolutely be evaluated by a professional right away. Moving on to checkup number 2, which is aggressive PSA prostate testing for men and annual mammography for women who are at low risk. Let me be remarkably precise and careful here, because this specific topic demands an immense amount of nuance. I am absolutely not telling you to never check your body for cancer. Cancer screenings have undeniably saved millions of lives over the decades, and they can absolutely save yours too. What I am explicitly saying is this: after the age of 75, aggressive, routine cancer screening in average-risk, completely asymptomatic individuals has a massive, documented overdiagnosis problem. And overdiagnosis leads directly and unyielding to overtreatment. Let us define what overdiagnosis actually means in plain, everyday language. The medical imaging and lab technology we possess today is so extraordinarily sensitive that it can detect microcancers that are, biologically speaking, barely awake. These are tiny, exceptionally slow-growing tumors that, if left completely alone, would never spread to other organs, never cause a single physical symptom, and never shorten your life by a single day. Statistically, you would eventually pass away with them in your body, not from them. But the very second a well-meaning radiologist or pathologist writes the word malignancy on an official medical report, the massive automated clinical machine immediately roars to life. Biopsies are scheduled, urgent specialist referrals are made, and high-stakes treatment decisions start moving forward like a runaway freight train, completely ignoring whether that specific cancer actually posed a tangible threat to your survival. Consider a real-world case like Richard's. Richard was a 79-year-old retired mechanic from Georgia. He was sharp as a tack, completely independent, and still spent his weekends out on the lake fishing with his grandkids. During a routine physical, his doctor ran a standard PSA blood test and it came back just slightly elevated. That prompted a prostate biopsy, which officially confirmed a very low-grade, slow-moving form of prostate cancer. His urologist, following standard automated protocols, recommended a course of radiation therapy. Richard trusted the white coat, believed it was the right thing to do, and went through the treatments. Within a year of finishing that radiation, Richard was dealing with profound chronic fatigue, painful urinary issues, and a total quality of life that had dropped dramatically. Stories just like Richard's are thoroughly documented all across peer-reviewed medical literature. These are men who, looking back on their lives, deeply wish they had understood that their specific cancer was the exact kind that a man his age would have easily lived alongside, rather than died from. Having that honest knowledge up front might have completely changed the choices they made. It is the same story for women. Major studies published in the New England Journal of Medicine have revealed that a very substantial portion of breast cancers detected through routine mammography in women over the age of 70 were actually clinically insignificant. This means the aggressive treatments they endured, like surgeries, radiation, or hormone blockers, offered absolutely zero statistical survival benefit, but subjected them to significant, life-altering side effects. What should you do instead? Sit down and have a deeply honest, personalized conversation with your primary physician about your actual specific risk profile. If you have a powerful family history, known genetic markers, or a new physical symptom, then by all means, screen aggressively. But if you are at average risk and feel completely fine, ask your doctor directly, if we run this test and find a tiny abnormality, what are the realistic treatment options for someone my age, and would we even need to treat it? That single question alone completely changes the dynamic in the exam room. If you are still here with me right now and finding this information incredibly helpful, take a quick moment to type the number 2 right down in the comments. It lets me know you are actively watching and getting real, tangible value out of this deep dive. Now let us look at checkup number 3, which is routine cardiac stress testing without any active symptoms. This is the one that almost always catches people completely off guard because, on the surface, it sounds so incredibly logical and responsible. Your doctor looks at you and says, "Listen, you are 72 years old. Let us just run a quick cardiac stress test to make sure that heart of yours is doing okay." So you lace up your sneakers, hop onto a treadmill while hooked up to monitors, or they give you a chemical medication that temporarily mimics exercise to stress your heart while they watch how it responds. It sounds entirely benign, like a routine check on an engine. But here is the massive problem. Cardiac stress tests performed on individuals who have absolutely no physical symptoms have false positive rates that can easily reach 40% or even higher in certain populations. That means nearly half the time, the test flags a scary-looking abnormality when your heart is actually completely fine. But because medicine cannot just shrug its shoulders and ignore an abnormal heart report, that false alarm immediately launches you into the next, far more dangerous phase, which is a cardiac catheterization. An angiogram or catheterization requires a cardiologist to thread a long, thin plastic tube all the way through your blood vessels, typically entering through your wrist or your groin, and pushing it directly into the chambers of your heart. That is a highly invasive, major medical procedure. The inherent risks include severe internal bleeding, permanent blood vessel damage, dangerous cardiac arrhythmias, and in rare but tragic instances, the procedure itself can actually trigger the exact heart attack or stroke you were trying to prevent in the first place. And here is where the math gets even more shockingly counterintuitive. If that invasive catheterization reveals a partial blockage in one of your arteries, which, let us be honest, is an incredibly common finding in almost any adult over 70, many of whom live completely normal lives with it, you will very likely end up with a surgical coronary stent placed in your heart. However, multiple landmark clinical trials, including the massive, widely cited ischemia trial, have definitively found that placing stents in patients with stable coronary artery disease did not reduce the rate of future heart attacks or extend a person's life by even a single day when compared to simple, optimized medication and lifestyle management alone. Let me repeat that because it is so incredibly vital to understand. The invasive surgical stent did not help the patients live longer or better than basic conservative medication, but it absolutely carried immediate, real procedural risks, and it forced those patients onto a lifetime of aggressive blood thinners, which carry their own dangerous risks of internal bleeding and bruising. So think about the journey. You went from feeling completely fine to getting a routine test, encountering a false alarm, undergoing an invasive catheterization, getting a permanent metal stent, and ending up on lifelong medication. And statistically, you are not a single bit better off than someone who skipped the stress test entirely and just managed their health with standard blood pressure medicine and a nice 30-minute daily walk. What should you do instead? If you have absolutely no chest pain, no unexplained or sudden shortness of breath, and no dizziness during physical activity, a routine stress test is simply hunting for problems in a population where blockages are common, but intervention rarely helps. Talk to your doctor instead about aggressively optimizing your baseline cardiovascular risk factors. Focus entirely on your actual blood pressure numbers, your blood sugar, your daily activity level, and the quality of your sleep. That is where the real life-saving health gains are actually found. This brings us directly to checkup number 4, which is routine bone density DEXA screening, coupled with the automatic pipeline of immediate medication. Now, this is a topic that can make people feel incredibly defensive and uncomfortable when I bring it up, because osteoporosis is a very real medical issue, and accidental falls are undeniably devastating for older adults. So, let me be exceptionally careful with my words here. I am absolutely not questioning or denying the stark reality of age-related bone loss. What I am questioning, and what the scientific data challenges, is the automatic clinical pipeline that almost always follows a low DEXA scan result in patients who are over the age of 75. The moment a DEXA scan detects low bone density or osteopenia, the standard medical reflex is to immediately write a prescription for a class of drugs called bisphosphonates, which include very common medications like alendronate or risedronate. Millions of older adults take these pills every single morning for years, completely assuming they are perfectly protected from ever breaking a bone. But here is the critical piece of information that so often goes completely unmentioned during that quick office visit. Long-term use of these specific bone medications, typically past the 3 to 5 years,